Welcome back to another episode of Questions with Crocker with me, Dr. Crocker, and my husband, Shane.
Hey.
How are you doing?
Wonderful.
Are we making it?
I think so.
Okay, good. So we are excited to be here today. Last week we had a guest.
Are we excited to be here?
We are. It's another day. We're alive. We're doing good. Kids are great. And I'm about to start a row of overnights. So it's going to be you and the kids holding the fort down for a little bit. Not excited about that?
No.
And of course, we're in the middle of end of school year activities and club volleyball tryouts, which is next level stressful, I feel like. I swear volleyball tryouts are more stressful than like sorority rush, potentially. I didn't actually rush a sorority, but I'm guessing. But it's an intense time. So we are planning a vacation in August, just the two of us. And I feel like we're those people that like go really hard and then we say, okay, but we're going to have a break here. And then we just look forward to that. What do you think?
I think that sounds right.
So if anyone has a good recommendation for a vacation spot, couples only in the States, quiet, calm, good food, rest, shoot us a message on our social media. And by the way, if you want to follow us on social media, it is at Questions with Crocker. Harrison said I need to say this earlier in the podcast. So you can listen to us on Apple or Spotify. You can leave us a review and feedback, which we would love. And you can send us additional questions through our social media accounts at Questions with Crocker on Instagram and TikTok. And then you can watch our lovely faces on YouTube. Right now it's early in the morning. We're not exactly awake, but we're trying our best. So speaking of schedules, so a couple things. I have Fetch Nashville coming up here in about a week and a half, and I'm excited about that. I'm going to go speak on a couple emergency things for general practice veterinarians. I'm going to talk about intentional discounting, and I'm going to see my friend Dr. Molly, and we're going to be doing some meet and greet stuff and catching up with people. So you don't get to come to that one. I'm really sorry, but
I can tell the excitement of how sorry you are in your voice.
I'm going to miss you guys so much. No, I do like to travel and see people, but I do miss you guys too. And then you and I will be at AVMA in Austin in June, and that will be a big conference. We'll be podcasting live on the exhibit floor, which is really exciting, and we'll have other things going on. So you'll come to that one. We'll golf. We'll have a good time. It'll be great. You're just nodding your head at me right now. Speaking of our children, Corbin was telling me something funny this morning. So our son is an extrovert and a talker, and pretty much from the time he wakes up in the morning till he goes to bed, he talks. So this morning he was talking about how our cat Bobby sleeps with him and loves him the most, but that when he grows up, he is going to live somewhere and he's going to take Bobby with him. And I said, well, hopefully Bobby's still alive. And then we had to have a whole conversation about how long do cats live. And now he's going down that path. But he also said he might not want Bobby because he might want a cat that he can get another cat also with, because he wants lots of cats. And so he might be that guy that lives alone with lots of cats. I don't know. But it reminded me that for years now, I have been telling him we can't get another cat because Mr. Bobby doesn't like cats and he wants to be the only cat, because Bobby hissed like once at a kitten that I like brought around. And I was like, oh, he doesn't like cats, and I've used it as an excuse. And I don't know that I'm technically lying to him or not, but it's worked. So
Definitely a gray area.
It's a gray area. And Bobby has urinary issues. We don't want to stress him out, but a little white lie to keep like peace in the house. Not the worst thing ever, right? But now he's going to go and make up for it by having...
Just out of curiosity, how long will Bobby live?
I think cats on average live in their teens. So like 13, 14. I have some cats.
How old is he now?
Well, he was a rescue, so we don't know for sure. But we're thinking 6 or 7. But I do have cats that I see that, I mean, people claim are 18, 19, 20 years old. So they definitely live longer than dogs do, but they're lower maintenance. So, and he's a cool cat. Like, you're not a big cat person, but he's not bad.
Great.
All the cat people are like, we want him to live forever. And you're like, how much longer? Okay. So our kid will probably be Corbin the crazy cat guy when he gets older, but that's okay. The other thing is we have an update on our renovation. We own a general practice veterinary hospital. I am an emergency vet and also work emergency. But it's interesting because we're putting all the cabinetry in and doing all the tables right now. And the team came to us and said, we're not real sure we want this layout. We kind of want to move things around. We want to keep this separate. And do say that we have like an open door policy and I want everyone to give me feedback. But I do think there's a point as a leader when you get feedback and you get feedback and you get feedback and you finally have to say like, okay, we're done discussing this and make a decision, especially because we needed to figure out like where we're putting everything. So ultimately what I came up with is I could fulfill what they wanted, but what it means is I'm taking away a doctor office. I'm taking away a room that the doctors can just go alone and kind of hide and do phone calls and do stuff. There'll still be plenty of space around their workspace and desk space, and I can give them space to make phone calls. We're going to have a call center, but they're not going to have a room just to themselves. And I think that's the traditional way to do things. I don't necessarily love it. I like having the doctors like with everybody because I think it helps for it not feeling like they're not doing as much, even though they are doing things. But it is easier to go in your office and kind of hang out sometimes and not know what else is going on. And then, you're asking why things aren't done, but you're not really aware of how busy everyone else is. So what are your thoughts on that? And what are your feelings on it?
I think from a business perspective, we make money when doctors are seeing patients or doing surgeries, not necessarily when they're in an office.
So you don't want them sitting in an office for long periods of time?
My preference would be not sitting in an office for long periods of time. The flip side of that is I can understand why they would want a place to get away and make a quiet phone call if it's going to be a tough conversation.
Mm-hmm.
So,
yeah. And so I think it's important to give them a space to make phone calls. But it is interesting because I think with the two doctors we have right now, the one that kind of sits out where everyone is already, I think that she, it's easier for her to like bond with everybody and get to know everybody better and then the other one who sits alone, like you don't see that as much because they just don't have that small talk and they don't have that time like with everybody. So it'll be interesting to see how it works out. But I basically had to say, well, if you want all these other things, you're not going to have an office. So what is more important? And I just had to make a decision. So we'll see. It's not always fun being the boss.
There's plenty of space.
There's plenty of space. There will be desk. It just won't be a enclosed space all alone. So if you're a doctor and you have strong feelings about that one way or the other, I'd like to hear about it. But I work out in the middle of everywhere.
But this is also coming from a doctor who is an extrovert.
For me?
Yeah.
Yeah. No, 100%. I think that if you're more introverted, yes, like having a quiet space to think and do things is great. But on the flip side, like we have technicians who are introverted and they're not going to have a space that they can just go. I mean, there'll be a break room, right? But they're not going to have their own space that they can go. So the fairness question is always there of, does it make sense that doctors get a space and technicians don't necessarily get an individual space? And maybe some practices are so big that they have multiple offices for multiple, people, but I think it's going to be interesting. I think in the long run, it's going to end up being best for our culture and our team. But I'm trying to respect kind of what everyone wants. But ultimately, I can't give everybody what they want in every circumstance. So it's been an interesting thing. We also had an interesting interaction. I wouldn't say interesting, a rude interaction with a client recently. So we had somebody come in and they were a PhD. They made sure to let the doctor know, like, I'm a doctor too. But had a ton of questions, had the workup done on their dog, the whole time questioned pretty much everything that was said, talked over the doctor. She was very patient, very good with him. I probably wouldn't have been as good as she was. Kept asking like why he had to pay for prescriptions, why he couldn't get things over the counter. We had to have an explanation of where doctors, we prescribe medications, has to come from, pharmacies, things like that. So already tricky person to kind of deal with, right? But try to be really respectful and understanding of what he was asking. So basically, we said, we'll do estimates for you so you know exactly the cost of everything we're recommending and, we're transparent. So went and did that and the technician went back in the room to show him the estimate. Totally normal for us that the technician goes over the estimate after the doctor's already talked about what the recommendation is and why it is what it is. And she walked in and he looked at her and he said, I paid to come see the doctor. I didn't pay to come talk to a technician. And he was like, you need to get the doctor. And I will be honest, if it was me as the doctor, that probably would have rubbed me very much the wrong way. Because one, everyone on the team is very capable of discussing an estimate and why we're making the recommendations we're making. And two, just the way he said it was very dismissive and disrespectful to the technician and their knowledge and how hard they work. And so He was with somebody who was a lot more, I guess, calmer about things. And so she went in and she answered his questions and did everything. And they took care of the pet, which was important. But I think in the long run, this probably is not the type of person I want in the practice if they're going to demean team members like that. How would you have handled that situation?
I probably would have taken care of the pet, but then requested that they go somewhere else in the future.
I mean, I've definitely gone in and said, hey, I heard you said this to my team member. Let's talk about it. And you don't have to be rude about it, right? But I think it is worth saying our technicians are trained to discuss estimates. This is how it works. I
don't think we are responsible for having to explain why we do things a certain way.
Ooh, interesting.
Like that's our process. That's our policy. That's how we do things. So if it doesn't work for that patient, then that's fine. They'll find somewhere that does work. But we're not going to change our process over one patient.
One client that's upset about it. No, that makes sense. I think for me, I want to always try to explain and maybe more stand up for the team member that was disrespected. Like maybe it's not as much for the pet owner, honestly. It's more for my team to know that like I have your back. I think you're capable. I respect you. So I'm going to go in and explain why they can't talk to you this way or why they can't say this to you. And, really it's not as much to try to get that pet owner on board with what we're doing. It's more so to show that I really do believe in them. And I don't think that's the right way to be treated. So I will just say that he was lucky he was with the people he was with, because some of us might not have handled that quite as gracefully as she did. So, but I am appreciative of having all different types of personalities in the practice. So speaking of being able to do things that the way that you want to do. So we interviewed Dr. Staten, and she made the comment that they don't do nail trims anymore in their practice. Now, what she means is kind of the routine convenience nail trims. They don't spend a lot of time doing those. They will do medically necessary ones. They will sedate and do nail trims, things like that. But for ones that really the pet owners could probably learn to do it, or they could go to a groomer, they're like, we're not doing that anymore. And this video blew up. I think it's at like 500,000 views so far. And the comments are wild. And the biggest comment that I kept seeing from pet owners, and I thought this is really interesting, is they said, it's your job to do this. And automatically that rubbed me the wrong way, because one, I know practices that don't do surgery at all, right? I know practices that, only do surgery. I know practices that do low cost, but they don't do any sick pets. I know practices that won't see any like dogs. They only see cats. So telling any veterinary hospital, like, this is your job, you have to do this. And it was some people in our profession saying that was just wild to me.
Yeah, that's crazy.
And Dr. Staten actually stitched a video, and she made a good comment, and she just said, this is what's wrong with our profession. Like, our profession is struggling. It's not sustainable. We have people leaving in droves, people unhappy. And yet we're telling somebody, you can't do it different. Why would you do it different? Like, if things aren't going well and you say, I look at my team, my culture, and this is best for my hospital, and you make a change and people are really happy about it. Like, there's a ton of people that said, we don't do them either, and we love it. It's great. She said she can hire easier. When she tells people you don't have to do nail trims here, people are like, sign me up right now. So she's doing things differently, and people are like, that doesn't work. Don't do that. It's your job. You have to provide this service. And I just thought, no, actually we don't. And I think that's a really important message we need to keep putting out there for pet owners. Like, we can decide exactly how we want to provide service and what we want to do, but also, I guess, for the people in our industry too.
That's wild that somebody in the industry would say you're required to do that, or that's your job.
Oh, yeah. I mean, that was some of the most aggressive comments. They were saying they were lazy because they weren't doing it. It was, so reading it, you're just like, and then she made the point of, and then we wonder why our profession is struggling like it is. And it's because of that way of thinking, right? So it makes me honestly more and more want to do things different and want to try things different and continue to show, guess what? It can be done. Like, so many people said it doesn't work. And I literally was like, actually, it does. They've been doing it for years and they're fine. She has a thriving practice, like super busy.
And again, market defines what happens, right?
Right.
If the customers were so distraught that they couldn't do that, they would go to a different vet, and you would see the result. The result of that. Mm-hmm. So I don't know, it's crazy.
It was very crazy. So I think it is important for people to know, like, we define as veterinarians and as practice owners what is best for our team. And if
you're not, that's a problem.
That's a problem. Yeah. Like if you cater to every client for everything.
That's a huge problem.
Huge issue. And that's where you hear people saying our leadership doesn't back us up. Our leadership doesn't support us.
Burnout and stress and everything else.
Trying to be everything to everyone. That is not sustainable. So I thought she did a great response. If you haven't seen it, you need to check out Veterinary MBA. Because
I hate that she got hammered because of that. But at the same time, she's somebody that should be highlighted for what they're doing, right? Mm-hmm. So even if this negative turns into a lot of people saying, hey, what are they doing? This is kind of cool. It could be good, you know?
There was quite a few comments that said, where is this? I want to work there.
Yeah.
Like, where is this practice? Because I would love that. And I was like, okay, hopefully she can focus on those. And she is like tough enough, thick enough skin to know how to handle these situations. But I loved her response. And I think
like an old marketing thing, like there's no bad comments or no negative
publicity,
reviews or something.
Like all publicity is good publicity or something like that. Yeah, no, I think so. And, you know, she got a ton of messages and I did too that weren't even people posting who were saying like, this is amazing, or I had this crazy experience, or I wish my practice would do that. And so on the whole, honestly, it was positive.
The other thing that's kind of crazy is some of those people probably took that 30-second clip and made this whole judgment about her and her practice. It didn't even bother to, you know, go research or listen to the entire podcast and see what they're doing that's so cool outside the box type thinking.
Yeah.
Just wild to me.
That's common, right? Like on social media is people will watch something for 2 seconds and then blow up about it. But I also told her if a video goes viral, you're going to get that. I mean, the less views a video gets, the more people that are going to be like your followers and support in like a smaller circle. The farther out there it gets, you get more wacky comments and trolls and people, you know, that are going to be fired up.
Which is good because, like you said, some vets out there might be like, "Hey, we need to stop doing this, or this is something we may ought to consider," or you know, not be afraid to make changes.
I mean, we've talked about it, and what we're looking to transition to is we're going to have a groomer in the building and just having them do those non-medical necessary ones. And so we've talked to her about how to do that, how to schedule it. She's totally fine with it. But, you know, passing it on to her because that is something, one, she's really great at it. She's really fast at it. And then it's going to free up our technicians to continue to do the things we need them to be doing. So but I wouldn't have really thought about it unless I had talked to Dr. Staten about what she was doing. But in general, the feeling of, no, you have to do this for us, the entitlement was just interesting. Yeah. So go check that out on my social media account if you get a chance. Finally, let's get to our question of the day. So this podcast is based off of questions that we get from people, sometimes through our social media accounts, sometimes on my videos. And so I made a video recently, and it was kind of a joking video where I said, you know, you give pet owners the allergy spiel, like you tell them all about allergies and that it's usually environmental, especially here in Texas. And then at the end, they just say, well, I'll just change the food. And it feels like they just missed the entire point of what you said. And so Candace Taylor said, okay, but what is the treatment for environmental allergies? And I thought that was a great question. And I could kind of give more insight into it in case anybody really wanted to know more about it. So the first point is allergies are an overreaction of your body to something. And yes, it can be a food reaction. Usually food allergies are going to present by having more like lesions around the mouth, sometimes having anal gland issues. So think about like where the food goes in and goes out, right? Also maybe having more gas, having an increased bowel movements. There was a study that showed if your dog goes to the bathroom more frequently, even if the stool's normal, that could be a food allergy issue, but less so kind of the distribution of itchiness that we'll see with environmental. Environmental, you'll see that they're licking their paws or licking their belly. They have a lot of redness down here. They'll get a lot of ear infections. Sometimes if it's a flea allergy, they'll get really itchy right like by their back end and up under here, so the place that fleas are. But you'll see the distribution really different in like the lesions on the skin and the itchiness. So that's kind of your first clue of which one it is. Could it be both? Absolutely, right? But here in Texas, a majority of dogs have environmental allergies. We'll have people move from other states and their dogs just explode and they're licking and chewing and sometimes bloody. I mean, it can be really, really bad. So the first part of environmental allergies is figuring out ideally what is causing it. If they're mild allergies, there are some things you can give them that will help, kind of like how we take Zyrtec and Claritin, which don't work great in dogs. But there's other things you can give to block like the allergy pathway in dogs, right? Sometimes you can do that for mild ones, like my sister's dog. He itches occasionally. We give him a Cytopoint injection and he's fine for 6 to 8 weeks. But if they're really licking, chewing, red, losing hair, then they need a full workup. And really what they need to do is get allergy tested, because it can be anything from dust mites in your house to grass and pollen to oak trees. And so the time of year matters and all that. But really for treatment and control, long term, the best thing is allergy testing and then immunotherapy where you like desensitize them.
So in humans, for allergy testing, they just stick them with a bunch of needles, right?
Yes.
What do they do for dogs?
So you can do that. And that's actually the best testing. You can actually send them to a veterinary dermatologist, which that is a thing. And they'll usually give them like a light sedation. And
do they trim nails?
No, they might while they're sedated. I don't know. Almost anyone will do it while they're sedated. We'll have to ask our friend, Dr. Ashley. But they will actually do the skin testing and they will see if there's a reaction. And then they can formulate immunotherapy. So they can make either shots or an oral solution that you give your dog with the allergens in it, just like people for allergy shots. And you can desensitize your dog. Now, last I heard, about 85% of dogs will improve on immunotherapy. So it will dramatically help their allergies. So it's not 100% effective. And the other thing is it takes months to see the result, right? Just like people, like you got to do the shots, you got to do the immunotherapy. There is also some testing that general practices do, like we do Nexmune. So we draw blood and we send it out.
I do that bill a lot.
We do a lot of allergy testing here. But that's another way to then get back the formulation of immunotherapy. So it's interesting because, you know, when you read the comments on an allergy post, everyone's like, well, you should feed coconut oil and you should do this and you should give this supplement and it'll help. And I did this to my dog's food and it helped. And they're looking for all these natural ways to help their dog's allergies, which makes sense, right? You're scared of chemicals. You don't want to give medication all the time and it can get expensive. But I need pet owners to hear me on this. The most natural way to treat allergies, to try to cure and control allergies, is to do allergy testing and immunotherapy. Like you're using the body's natural mechanism to desensitize them to the allergies. And all you're doing is giving them microdoses of an allergen. You're not giving them chemicals. You're not giving them anything major. So, you know, for everyone who really wants to go the natural route, seeing a veterinary dermatologist, getting accurate allergy testing done, and doing immunotherapy is the most natural route you can absolutely do to help your dog with allergies. But they would much rather slather them in coconut oil and give them these random supplements off the internet versus doing that. And so it's kind of mind-boggling to me. And I think cost is part of it, right? Like going and getting that done is going to be, I think it's $750, $800 in our area. But I will tell you, if you go to your vet 4 times a year for an allergy flare-up, you're going to spend that amount of money. So I usually say, let's go get you allergy tested. Let's get your dog on immunotherapy earlier, as soon as we realize that's what's going on. And that's actually going to save you money in the long run. Does that make sense?
It does.
So I don't.
But you also have some crazy math around Starbucks stuff sometimes too. So.
Oh man, I want a Starbucks right now, actually. So, but I want people to know that if their vet is recommending them going and getting allergy testing done, they're actually trying to help.
Yeah.
In the long run. I actually make more money off of allergy dogs that are not getting allergy tested and hopefully getting like a huge reduction in their allergies because they lick and scratch, they get secondary infections, they need to go on 3 weeks of antibiotics, antifungals, like they got to get Cytopoint, Apoquel. Like you make more money off of those things at a vet hospital, frequent visits, right? So if I'm telling you to go and like, let's just get this fixed and figured out, or at least control it better, I'm actually going to lose money.
It actually seems like something that's fairly easy to control.
What do you mean?
I mean, you think about some stuff that's hard to like figure out for your pet.
Yeah.
And expensive, doing a bunch of, you know, tests to try to figure it out. It sounds like this is pretty straightforward. Like, go here, get it done.
Yeah. Like, go do the skin test, talk to the expert, and let's see if we can. And, you know, there was a lot of people on comments of that post saying, I did this and my dog it's amazing the difference. And there's people that say, you know, I started giving Cytopoint and it really helped. There also is people trolling me that are apparently part of a group that talk about how all these things kill pets. And so they were saying that, you know, I was a dog killer because I was talking about these allergy medications, and you're going to get that.
How many dogs have come in and died because of Cytopoint?
None, actually. It's a monoclonal antibody, so it's even like a really safe medication, like the way that it works. And I mean, I recommend it for my sister's dog, so I must not think that it's going to kill dogs, and I must not see that. So I think, you know, that's part of being on the internet and trying to educate is you're going to get a lot of crazy things said and a lot of crazy feedback. But number one natural way to treat your dog's allergies, immunotherapy that's done based off allergy testing, period. That's what you have to do. And the sooner you do it, the younger they are, the better long-term outcome.
Do allergies change over time?
That's a great question. So yes, they tend to get worse over time because if you think about it, a lot of it's seasonal with environmental. And so your body reacts. And it seems like the next season, your body reacts more. So we will have some people that are giving allergy meds and their dog's doing okay. And then all of a sudden we hit a year where we're like, it's not working as well as it used to work, or they're getting a lot of infections, or they're still super itchy. So then we have to kind of go into, okay, we really need to allergy test at this point. And there are some things owners can do at home. Bathing, because it's environmental, taking off pollen, taking off things that are irritating absolutely helps. Flea prevention, because flea allergies is a huge component. We had Boudreaux, remember our lab? And he would lose all his hair on his back end if I forgot his flea and heartworm prevention at the right time. And that's because he was allergic. So he would get, you know, a couple flea bites and just his skin would start, or his hair would start falling out. So there's things you can do to, you know, treat the skin, reduce the allergens on the skin, and try to reduce flare-ups. But in the long run, you really just need to figure out exactly what it is and try to desensitize, especially if you live somewhere like this. It's funny to me when people that live in like California or Utah or somewhere are like, well, we've never had these issues before. And I'm like, I know. Welcome
to Texas.
I didn't have allergies when I lived there either. Welcome to Texas. I do always say, well, things are less here. People are really nice, but you're going to have to deal with a lot more infectious diseases. So welcome to Texas. Sorry. But other than that, things are great here. I love Texas. So any other questions about allergies? Is that clear as mud? Does that make sense?
Yes.
Okay. But I do appreciate her actually asking, like, okay, so what are the treatments? Because I just made like a short video, a little sassy video, and the comments were wild. So that's the internet these days for sure. Anything else you have going on? Anything else you want to share?
Nope.
You doing okay?
I think so.
I feel like I talked a lot on this episode. I'm sorry.
That's fine.
Are you awake
I'll
yet?
survive. I'm not going to lose sleep tonight, I promise.
Okay, good. Well, I won't be sleeping tonight because I'll be at the ER, but hopefully I will not see anybody there that I know, and everybody will be healthy and happy. All right, you guys, thank you so much for listening. Again, if you want to leave a review, you can go on Apple or Spotify and leave us a review. If you want to give us feedback, go to Questions with Crocker on TikTok, Instagram, or Facebook, and you can watch us on YouTube and leave comments there too. Thanks so much and have a wonderful day.